It's Adam Thilthorpe here from BCS, and it's another one of our quick 10-minute chats that we're doing with various people across the NHS and the wider health and social care community. And today we have Andrew Griffiths joining us, who until very recently was the CIO in Wales and has now become added to that portfolio. He's the Chief Exec of the Federation of Informatics Professionals. So welcome to Andrew. Hello.
Hello.
The first thing I'd like to check, I'll be checking with everyone. We've seen lots of stories that the pandemic has really accelerated people's the take-up of digital and real acceleration of adoption. I just want to qualify and check that really. And has that been your experience over the last few weeks and months?
Yeah, I think so. I mean, I've been not so much in the front line of it of late, but my sense of it is that people have really embraced some of the technologies that have made working from home easier. Some of those technologies are the technologies we want them to use in work as well. So I think people are getting more familiar with the technology and kind of learning for themselves what works and what doesn't work. So I think there was certainly a big ramping up of, how do I work from home? How do I access all the information that I could previously in work? So I think that's been positive. And I think there's been some really notable examples of where people are starting to transfer what you would regard as core NHS work into the sort of digital space and take advantage of things that are already there. So I think there's been a big shift. I think the key thing would be how do we maintain that momentum and keep people thinking in that new way rather than reverting to what they've always done, which is the NHS's greatest excitement is to revert back to what they've done previously.
So how do we stop that from happening? You're right. There's people are, at the very least, people are open to a conversation now about how digital is going to enhance both patient care, but also our ability to deliver, the promise of the NHS, healthcare, health and social care free at the point of delivery. What's the danger, do you think? How do you think that's manifested in the past, and how do you combat that?
Yeah, I think in the past, I'm reasonably hopeful and optimistic. I think in the past, there's been a real sense of, and it's right to do this, of piloting things and then hoping that it will roll out and then trying to encourage that rollout. And inevitably what you get in the pilot stage is the enthusiasts who know why they're there and they know that they've got to try and prove that this thing works. And in a sense, you've all got a little bit of built-in bias to make it possible. So there's, perhaps that's overcompensates in one direction. But then also what happens is that people very often don't like things that they haven't been involved in, or the not invented here kind of syndrome. So I think that is kind of, that has really been hard to overcome those sort of barriers. But I think what I would say has happened now is that people have had to fall back on, well, what can I do to actually still serve the patients in the way that I can't do now. And in a sense, they have owned it a little bit more, I would suggest.
Yeah.
And so they've recognised that actually I can see that information, the current medication list on the screen rather than looking at the notes or asking someone else. It's my only way of getting it now. Oh, hang on, it's quite good. Actually, why don't I ring the patient instead of, and all those kind of things. So I think there's been a far broader taster session for people right across the NHS in what the art of the possible is. And I've seen some particular examples of that, through sort of personal context. My auntie and uncle used to go every month to a particular clinic. They see the pharmacist, review the medications, decide what changes need to be made, issue a new script. They pick up the new tablets. And so what's happened there? I'm sorry, Siri's interrupted me for some bizarre reason. I obviously said something that has decided to do that. I'm so sorry. Okay, well, that's right. They're never listening to you. So I think what's happened there is that previously the pharmacists would have done what they've always done, which is bring the people into the hospital. For my auntie and uncle, that was a 2-hour thing of getting there, parking the car. They'd want to be there an hour early to make sure they could park, going in, sitting in with a room of 30 or 40 people, waiting a long time, eventually seeing someone for 10 minutes, coming out, picking up the meds. Well, immediately that we had the lockdown, they were rang by the folks. Pharmacist said, I've got your record in front of me. In fact, my auntie's reflection was, it was better. They seemed to know more about me because they didn't have them there. And they went through, made the changes, said, you don't need to come in to see us. we've issued a new script. It's at your pharmacy. Just pop along there and pick it up. So I'm hopeful that lots of people will say, hang on, this makes my life better. I haven't got 30, 40 people sitting outside. I haven't got the car park full. So I think there's a real possibility. But as you rightly say, and I think I made the point as well, there's a massive spring in the NHS that wants to go back to the way it has. And I think outpatients is a key area where we've got to make sure that doesn't happen. Because again, my sense of it from my time is outpatients is probably, it's an activity that started, when the NHS started, to bring together the clinician with the patient, with the notes. And unfortunately, the limiting factor there very often was the notes. Where are the notes? Well, they were always in the district general hospital as it was. But now we're not constrained by that. The notes is not our constraint. So why are we still trying to bring people into the hospital to bring the clinician and the patient together? So we've got to look at new ways. How do we do outpatients better, differently? It'll be better for clinicians, better for everybody.
So I guess notes these days translates to data, doesn't it? And the sort of, and how we sort of do that. And now that we've got this conversation going, as you said, between clinicians, patients, and people who deal with the data and understand the data, how do we professionalise, do you think, that industry? For a long time, I think there's been a certain, both in the NHS, but more wider in private and public sector more broadly, that on a bad day, the IT department is the department of no. Yeah. And how do we make sure when people are actually listening now and are sort of beginning to unlock the, as you rightly say, the hopeful message of what digital can do, how can we make sure that IT professionals are able to, they're respected as much, not just because they're in charge of all those sorts of toys, but they're respected because they're professionals of equal standing as well?
Yeah, I think it's a really vital thing for the NHS. So I think things have massively changed over, sometimes gradually over the last 20 years, but rapidly in the last couple of years, actually. I think it has massively moved forward again. I think there's something about how the profession has grown within healthcare over that time, from essentially amateurs, largely who came from, one of the other backgrounds within the hospital. Lots of pathology folks got involved in IT, and all of that was good. And it was treated like you do with anything that's new, as well, we're trying our best. And I think the IT profession within healthcare unfairly has got a little bit of reputation of, well, I'm not sure they really know what they're doing. I think they're good, but I don't really know. And I think we've got to really make the shift in that position from being viewed as being professionals who know what they're talking about. So my experience, again, in being in the health service for many a year, is that actually, if you went to a sort of reasonably senior meeting, you could sit around the table, there'd be a variety of different flavours of folks, all professionals, but everybody felt that it was okay to chip in on IT, and they all had an opinion about it. And it felt like, as heading up IT, you were just one of those other people with another opinion. Whereas the same wouldn't be true if you were talking about cardiology and the cardiologist was in the room. I wouldn't expect that because I'd read an article yesterday in some journal that I suddenly was the authority in that area. So I think there's a bit for us, how do we get recognised by everybody else as a profession? And I think that comes by people seeing it as a key role and understanding that they are actually reliant on this stuff now to run the service. And secondly, for us behaving like professionals. And I think there's a bit of chicken and egg in this. To be seen as professionals, you've got to behave in that way. And I think sometimes we haven't always had the rounded skills to represent our own departments in different forums in a way that didn't sound as if we were being chippy, if I can put it that way. That, oh, well, if only you give us more money, then we'd be able to do all these other wonderful things, rather than presenting the positive case and using different sort of leadership skills and being seen as part of that senior team. Now, that's massively changed in the last couple of years. I think there is recognition of digital and informatics being part of the senior team. I think what we're really going to do is build on that, keep on acting as professionals, starting to adopt those behaviours that you expect from the other professionals around the table. And then if we behave as them, we start treated even more like them. And, I can see that really growing, and it needs to grow. I think it's vital.
Okay. That's really interesting. I guess that points at your latest role, then, or one of your latest roles, Chief Executive of the Federation of Informatics Professionals. Now, what's your vision, you think, for that organisation in dealing with some of the issues you've already identified?
Yeah. Well, I think, again, as we've just been talking about, the fact that I think that the profession hasn't been taken seriously for all sorts of reasons. One, it's been reasonably young. It's been not seen as being totally vital, even though sometimes it has been. And it's been sort of hidden away, as you rightly say, in the dark corner somewhere. People just hope the all goes well. I think that has changed dramatically over the last 5 years. We are seeing senior leaders with great capability taking on roles there and being respected in those roles. But more than anything, we're seeing the technology playing an absolutely vital part. And if there is a way of actually stopping the running of a hospital, it is by taking one of the computer systems down. Now that brings a huge responsibility, I think, on us as a profession to make sure that we know what we're talking about, that we're competent. And so I'm hopeful that the time is right for us really to make those statements about us being a professional. You can trust us. Because again, one of the things that I used to find frustrating is people would come along with their pet project or the pet system or system they wrote last night, in Excel or whatever it may be, that actually isn't robust enough to run, digital services for healthcare on. And that's before we get into using digital as the treatment and AI techniques and all the other things that are really dramatically changing the way that we deliver care. So my hope in the new role is that we can get momentum here to getting people, individuals who are professionals, joining a professional body, getting on the register and saying, yes, we recognise that this needs to be a regulated profession, because in my role, if I do something wrong, then I can have massive effect on people, on the public, and on their healthcare. And actually, a story that the medical director of the organisation I used to run said when I was interviewing for the post, he said, in my role as a surgeon, I want to try and do good for people. I can do that for the people I see in my outpatient clinic and I operate on. But he said, in the role in informatics as a medical director and a CCIO, then I can make a difference for the whole of the population. So it's a massive opportunity. But the downside of that is if something goes wrong or we put the wrong algorithms in, we can actually mistreat people and harm people. So all the more important that we need to be regulated. We need to come to the table as a regulated profession, so that we stand up in a sense, and then we can be treated as professionals. So I think there's a two-ended thing here, trying to get people to recognise they are a profession, and also trying to get the powers that be to recognise that it is a profession. And we need a bit of pull from one end and a little bit of push from the other end. And if we can get those two ends moving, I'm hoping they'll meet somewhere in the middle, and we'll see, a massive change within the professionalisation of digital in the NHS.
Andrew, thank you. That's a very succinct point as to why FEDIP needs to be successful, I think. And I think we've seen that things have accelerated. We need to keep that pace of change going, not though because we're worried about a burning platform, but rather because we can see, as you rightly put, the hope as to what digital can do with regards to health and social care in the future. So thank you very much for your time.
Okay, thank you very much. Cheers.